Hello, everybody. Good morning. Everybody hear me? So I'm Rachel Dickinson. I'm the Research and Development Study Manager and the Communications Lead for the NIHR Newcastle In Vitro Diagnostics Co-operative. So I'm going to give a bit of a background on what we do and who we are. So we are one of 11 medtech and in vitro diagnostic cooperatives, or also known as the MICs. And we are located across England, and we're funded by the NIHR. So some of the MICs are focused on the development of new medical technologies or medtech, but there are a few other MICs, and we're one of these, that are focused on new in vitro diagnostic tests. So I'm going to talk a little bit more about them later on. But before we go any further, and you maybe can already see, and you may already be aware, that the NIHR are very fond of their acronyms. And the NIHR itself is an acronym. So I was interested in knowing whether you know what the NIHR stands for. So I think Charlie might help to launch a poll, and you can vote for what you think the NIHR stands for. Is it the National Infrastructure for Health Research, the National Institute for Health Resources, the National Institute for Health Research, or the National Infrastructure for Health Resources? So
I see those votes are piling in now.
Yeah. And yeah, I'll just leave it a few more seconds.
Yeah, right.
I think we'll probably, end that now. Yes, so very well-informed audience. Most of you got that correct. It is the National Institute for Health Research. Yeah, so answer 3 there, National Institute for Health Research. So the NIHR, it funds us, it funds a variety of other research centres, research programmes around the UK, and it's one of a number of different funding bodies. So the next poll question is whether you can identify which of these statements describes the NIHR. Is it a research charity that exists to improve health by helping great ideas to thrive? A UK government agency and the nation's largest funder of health and care research? A public body that improves the health of people in the UK and around the world by supporting excellent science? Or a public body and the largest UK public funder of non-medical bioscience? So yeah, a bit more of a tricky question here. And these are all statements that come from the websites of these different funding bodies.
A few more votes still coming through. Yeah. Not as clear cut this one, I don't think.
No, yeah, I did make this like a little bit more difficult. And actually when I ran this with other members of the team, a couple of them were unsure actually of the answer. Great, yeah. So so it's not a research charity. That's the Wellcome Trust. It's not, a few of you thought it might have been the public body that improves health of people in the UK and around the world. That's actually the Medical Research Council. It's not a public body and the largest funder of non-medical bioscience. That's the BBSRC. Yeah, most of you got this right. It is a UK government agency and the nation's largest funder of health and care research. So the NIHR is directly funded by the government and directly reports to the Department of Health and Social Care. So we get our funding from the NIHR And that award is held across Newcastle University and Newcastle Hospitals. So we're a partnership between those two organisations. So as I mentioned at the beginning, we're interested in diagnostic tests. So a diagnostic test can be used by a healthcare professional when they see a patient with symptoms for a particular condition, but maybe their initial examinations are a bit inconclusive. So in this situation, a positive test result may suggest that the patient does have that particular condition, and therefore that the healthcare professional would have more confidence to give the patient a particular treatment for that condition. But if the diagnostic test suggests that the patient doesn't have that condition, then in that situation, perhaps the healthcare professional would hold off giving the treatment as it might be inappropriate, and instead send for some further tests to get to the bottom of what condition the patient might have. So as I mentioned at the beginning, we're particularly interested in a type of diagnostic test called an in vitro diagnostic test. There are different methods for diagnosing a condition, and one of them is an in vitro diagnostic test. So next poll is whether you can identify which of these methods might be an in vitro diagnostic test. Is it a method that uses samples from the body to diagnose a condition? Is it a method that distributes an agent into the body to diagnose a condition? Or is it a medical imaging method to diagnose a condition? So, yeah, see how you get on with this question.
Everyone's pretty confident on this one.
Yeah. Very good. Yeah. So yeah, I think we can probably share those results. So yeah, you're all very, very well informed. It is a method that uses samples from the body to diagnose a condition. So that could be a urine test, saliva test, sputum sample, blood test. They're all examples of an in vitro diagnostic test. So final quiz question, and then you can all relax. Which of these is an example, therefore, of an in vitro diagnostic test? Could it be an X-ray test for detecting a breast tumour, a blood pressure test for detecting increased risk of heart attacks, a bronchial challenge test where a patient breathes in a substance for diagnosing asthma, or a blood glucose test for diagnosing diabetes? A few more seconds.
I think that's most people.
Yeah. Yeah. So yeah, very good. Most of you got that right. Yeah, the example here would be a blood glucose test for diagnosing diabetes. So this is our team. So we have most of the team are here today, and you'll meet them in the breakout session. And Amanda will be presenting a bit later on a bit more about how some of the things to consider when measuring reliability of tests. So we have a senior methodologist, director, deputy director, Kasia, our public patient involvement and engagement manager. There's me, Anna, our project manager, and then we have a team of methodologists that all have slightly different professional backgrounds, different areas of expertise. We have 3 different clinical themes that we focus on. So we have, and they're all led by clinical experts within the region. So we have an aging and long-term chronic conditions theme, personalised and stratified medicine theme, and an infectious diseases theme, which is the one that's been keeping us pretty busy over the last few months around tests for COVID-19. So we tend to work mainly with companies and with academics who are developing new in vitro diagnostic tests. And we try to help them get their early stage ideas and innovations to get them adopted into the NHS. And in order to do that, they need to provide evidence which we can help them generate. So we can help them hopefully show that their new test works reliably and accurately in the lab conditions. Then we can also help them compare how their test for a particular condition compares with other procedures and methods that are used in the healthcare setting for diagnosing that condition. And then finally, we also look to see whether this new test will actually then, if it's used, have some downstream benefit to patients and the wider NHS. And throughout all of these stages, we focus a lot of our work around something called care pathway analysis, which is where you map out the sequence of interactions a patient experiences as they navigate through the healthcare system with a particular condition. And we think that this helps to then identify where and when a test could be best used and in which situations. And we can also do work to see how the test would affect healthcare budgets. So we think of ourselves as a bit of a bridge between healthcare and industry. We have wide networks within these different settings, as well as also in academia. And therefore we can help to coordinate clinical studies. We can also help with the design and the data analysis, because we have members of the team that have expertise in statistical analysis. And then in terms of our care pathway analysis work, that tends to involve speaking to our wide network of clinical experts and getting their views on where and when a test could be best used. And we do that through interviews and through surveys, for example. So recently we formed an insight panel for public patients and the carers. And we hope that when you've heard a bit more about our work today, you might be interested in coming and joining our panel. And actually at the end of the session today, Gary, one of the members of our panel, is going to speak a little bit about his experiences of working with us and getting involved in research. So we consult with our insight panel with all aspects of our work. So we'll speak to them in quarterly meetings about some of the projects and grant proposals that we're preparing with companies and with academics. We'll also speak to them. I've got very valuable input from them around the website, making sure that the content on our website is public friendly as possible. And also we'll speak to them about our overall research strategy and research direction. So lately we've been focusing our efforts a bit more around COVID. And in the early days of the pandemic, we were writing a lot of rapid reviews to help medical staff with their decision making by reviewing lessons learned from different countries and around the world. So through reviewing literature and guidelines in different countries. Members of the team are also sit on advisory panels for different organisations, and they've been helping to review grant proposals and helping set up clinical studies in Newcastle hospitals, for example. And then we're also part of a research and evaluation platform called CONDOR. So this is it's a national platform that involves us working with the other MICs that work on in vitro diagnostic tests, and a similar organisation based in Manchester. And the idea is that we'll come up with a coordinated approach to robustly evaluate new COVID tests in hospitals and out in the community, such as in care homes. So just finally, within CONDOR, we've been leading a care pathway analysis work. Our infection theme lead has been helping to examine how these new tests for COVID-19 might work in the laboratory and helping to provide some preliminary data when needed. We're also leading statistical analysis on how the most promising tests may perform when they're being used in different hospital settings. And also we're involved in a variety of other activities that kind of cover different aspects of CONDOR, and this includes 2 of our members of our public panel that sit on the patient and public involvement and engagement panel for CONDOR. So I hope that's given you a little bit of an overview of our work. And now I'm going to pass over to Amanda, who's going to speak a little bit more about some of the considerations of our work.